webinar for the 40 Under 40 Public Health Catalyst Awards. Well, before we get started, I want to introduce myself. My name is Dr. Circe Lecomte. I'm co-CEO of the Boston Congress of Public Health. And let me hand it off to my colleague very quickly.
Hi there, everyone. Super excited. This is our first annual 40 Under 40 for the African continent. I'm Dr. Carpenter. I'm the other co-chief executive officer and chief strategy officer for the Boston Congress of Public Health. I'll say a few things, Dr. Lecomte. So this pitch, so those of you who are attending, we're assuming that you're here to actually pitch. So if you are just wanting to actually view it, this is being streamed live on YouTube. So don't feel like you need to be here in the Zoom room. The Zoom room is designed for people who are actually pitching today for their chance to win 40 Under 40. All right, back to you.
Thank you. Thank you. So we're going to be just doing a bit of logistics before we get started. We're going to be calling presenters in the order of the attendee list, which I'm going to be putting in the chat in just a moment. Be sure to check that your name is listed. Let us know in the chat if you are not. We're not going to have time today to answer any questions about the 40 Under 40. If you have questions, put them in the chat, send them to us through email, and we'll answer accordingly. Please be ready when your name is called. If you're not ready, we're going to have to move on. We want to keep things very fair, but please, we don't want you to miss your spot, so keep an eye on the order list. Every presenter is going to have 2 to 5 minutes to present. Once you get to about 4:45, there's going to be music playing because we are going to have a timer. To see it, it should be on the screen and it'll be in my window box. So please keep an eye on that. Everyone who completes their presentation today is going to be considered a finalist. You'll receive a certificate and recognition on our website. And after the session, we're going to be reviewing the pitches and we'll invite the strongest presenters to submit a full application. So let me put the list in the chat here.
All right, so as Dr. Lecomte is doing that again, so as we mentioned, right? So presentations, check your cameras, check your audio. This will move very quickly. If you're not able to start within 10 seconds, we will have to move on, okay? So 2 to 5 minutes, camera must be on in order for us to consider you qualifying.
Yes, yes. The first person on our list today is Yusuf Hassan Wada. I'm just showing the list on the screen very quickly.
Once it's your turn to speak, we will go ahead and unmute you.
Yusuf, we've allowed you to speak. If you are ready to go, we would love to hear your pitch.
Yes, just to be sure, can you hear me?
Yes.
Well, can you see my my camera?
We
No.
can't see you, but that is okay. If there's an issue, that's okay.
We really do want to
It's not,
But we do want to see you.
yes, I would love to see myself, but I can't see I can't see the button here because it seems like you have control over the whole Zoom.
Yeah, it might be that
So,
if there's a certain functionality that we can check to see that participants can turn on their camera, perhaps.
yeah, please check because I can't see anything here.
Try and see it now. See if it works now. Yusuf, are you able to see yourself now?
I can see. Yeah, you promoted me.
Oh, there you are.
Excellent.
Welcome.
Yeah,
It's very good to see
thank
you. Yes, yes.
Yeah. So, how do I go ahead? I should just continue.
Yes, please. And I'm going to have the timer come up on the side.
Okay. So, good day, everyone. I don't know from which country basically the panelists are, but the first thing is I am just sending my greetings to everyone. It's really a very honor to be here to speak to distinguished professionals and also invite me as part of the 40 under 40. So basically, I'll take the introductions. My name is Yusuf Hassan Wala. I'm a pharmacist by training. I have my Bachelor of Pharmacy and also a Master's in Public Health. And I work as a public health policy strategist from Nigeria, currently serving as a health policy officer for the Africa region with Society for Family Health. My work focuses on health system strengthening, universal health coverage, and community-centered primary healthcare delivery across this policy reform, research, and strategic partnership I work with. I work to ensure that essential health services reach underserved communities, particularly those historically excluded from formal healthcare systems. My path to public health is very it's very strategic. Basically, I grew up in Nigeria, a very low middle income country, and I have witnessed firsthand how access to healthcare is often determined by geography and income rather by need. So communities in rural and underserved areas, formally, especially, are being provided care through the informal providers because those formal systems are distant or under-resourced or even unaffordable. So I grew up in a place where access to that healthcare was often determined by need, but geography and income were a problem. So basically, what I do is actually I started as a as a pharmacist in the hospital, but I noticed that many of this Nigeria doesn't have access to hospital, but also a small medicines vendor in that neighborhood. So that entry point for them is the ability to read and write. We have lost so many people due to that low quality they provide. So I actually moved to the policy side to shape those things they do and also to become part of my mission, basically to transform those health systems so that they work for the people who depend on them. So basically, there's a research we have done 60% access through PPMVs and chemists. And basically, we have been on that long run to see even government recognize them. So basically, that reality have shaped my commitment to transforming health so that people can really access them. And that's why I have actually started to work on that gap between evidence policy and community-based healthcare delivery. So my work is actually very simple. I have actually provided a baseline. So basically, my work has really focused on transforming that primary healthcare, the informal primary healthcare, through policy reform and also community-centered services delivery models. So as also the health policy officer across the Africa region for one of the largest organizations in Africa, Society for Family Health, I have supported that national and regional policy reforms and also leveraged those service providers as those chemists and also those community pharmacists to expand care. So nearly 60%, but that number has really reduced. And we have also extensively provided them health financing and also universal healthcare reforms to see how possible they can really do. So basically, even when you look around the health financing landscape, we have been able to integrate HIV, TB, and family planning across the region. And we actually have ensured that even issues, particularly, for example, like this USAID, that we have provided financial protection for those millions of people across Africa. On the global side, I also work with the Martin Delany Collaboratory, which is actually an advisory board with the Johns Hopkins University, basically shaping how HIV cure research is being done in the world. And one of the key things we provided, I led the first pediatric HIV cure roadmap, which has shown advocate for increasing funding for cure research, which we have actually given over $15 million for them. Now, my main key accomplishments are many, but in 30 seconds, I'll summarize them. Beyond this policy leadership I have bring across Africa, I have authored over 30 peer-reviewed publications, mostly in Lancet, in PLOS ONE, in public health, basically contributing to policy reforms and also global conversation on health systems and also equitable service delivery. My work has been presented in 18 countries across various platforms, the World Health, the United Nations General Assembly, the International AIDS Conference for the past 5 years, and also many gatherings. I have also contributed to the global body which provide a real data for Africa and also the globe. And why should I be named for the authority? And what distinguishes my leadership is that I really committed connected research policy and community-driven solutions to address some African most pressing challenges. Across my work, I had built practical pathways towards UHC, and also I have shown that young people, particularly under 30, can really provide basic reform across Africa. Ultimately, my vision in Africa is operational, and also why healthcare is a privilege for everyone.
Thank you very much. Thank you very much.
Wonderful. Thank you, Youssef. We'll move on to the next person.
Yes, our next speaker is Akabome Biakolo. Let me go into.
All right. You said you were here. We will find you.
I found, and I have promoted you to a panelist. When you are ready to come on screen, please begin presenting.
There we are. And you are muted, sir. Unmute.
Yes, good evening. My name is Dr. Akubome Biakolo. I'm happy to be here on this 40 Under 40 Public Health Catalyst Award pitch. I'm a medical doctor by profession, and I've been interested. My choice of being a medical doctor was influenced by being able to have an impact to public health. Initially, also as a child, as I had health challenges, which my parents had to try a lot for me. So as growing up as a child, I had interest in public health, how to improve the general well-being of the society and to ensure that children and mothers don't suffer much, considering what I passed through as a child. So that led me, I have a Bachelor of Science degree in human physiology. Subsequently, I was the best graduating student in 2005, in 2006. So subsequently, in my youth service, I enrolled as a volunteer for United Nations Children's Fund, where I acted as a peer educator trainer in adolescent reproductive health and HIV/AIDS prevention. So this one was to, first of all, start to fulfill my dream of being able to have an impact on healthcare. And I've been a volunteer ever since, helping to educate young adolescents on how to be able to avoid peer pressure, avoid risky behaviors, and also to prevent HIV/AIDS and other sexually transmitted infection. Subsequently, I did my Bachelor of Medicine and Bachelor of Surgery degree, and I currently qualified as a medical doctor. I now specialize in obstetrics and gynecology, for which I'm subspecializing in maternal and fetal medicine research. I have made several impacts in telemedicine, where I've been a telemedicine consultant, and I've seen patients for which I won an award in 2024 as the best obstetrician gynecologist in Dr. Galen International, which is a US-based telemedicine platform. And I'm currently working with Dateline Africa, which is also a US-based platform where they are promoting public health, and in order to ensure that there's better health care globally. Through this platform, I'll be able to get the chief executive officer of the Dateline Africa to be on a visit to Nigeria, and is currently in Nigeria now, seeing policy and stakeholders in the healthcare in Nigeria, where it will help to shaping the healthcare in Nigeria, considering the fact that though we have a high population, we are resource poor. We are in a resource poor setting where there are many facilities that are not available. So working with these policy makers, it would ensure on his visit, which is currently on at the moment, it's currently in Nigeria to visit, and is visiting my state, which is Bayelsa State in Nigeria, and is going to meet with the stakeholders, the governor, the commissioners, and various healthcare providers. And as the key person and the anchor of this visit, I would ensure that the visit is fruitful. The policy makers the emphasis is on the areas that are key points, like in maternal and fetal health, which is my area of specialty, where we have a lot of maternal mortality, considering the fact that Africa contributes the highest burden for maternal mortality globally, and we are not happy about that. And with our effort, we intend to reduce these statistics to make life better, to ensure that a woman should not die while pregnant. And to be able to avoid this, we ensure that high-risk pregnancies are properly taken care of. Women who are pregnant are given the proper care. There's prompt diagnosis of any form of complication, and this is promptly treated. This will ensure that women don't get to the condition where they are severely ill and they lose their life as a result of complications of pregnancy. Then I've also worked with other platforms which help in as a obstetrician gynecologist, like Virtual Doctors Africa, where I've treated both obstetrics and gynecological cases, people with issues who are to ensure that even people who are unable to meet me physically, I could also make an impact to their health by using telemedicine. In so doing, I've impacted so much, both locally and globally. And as a result, I find myself fulfilled, and I intend to do more. My vision is to set up a platform, like a digital online service, that would be able to reach out to rural areas, rural women who have contributed to the high maternal mortality in Africa. These women will be reached out to tell them about their health, to tell them to make the right decisions, and in so doing, this will reduce maternal mortality and improve public health in Nigeria in particular, in Africa in general. Thank you very much for this speech.
Thank you. Thank you. That was wonderful. Next up is Cole Egged. I'm going to be promoting you to panelists so that you may speak. And you can share your screen. And I will also restart the clock. You're on mute.
I don't see the next speaker.
Okay. I've been checking the list to make sure who's next. So let's go to Cole. We'll have to move on. Butterworth Gobena is going to be next.
The person listed as number 4?
No, that person's not here.
Okay. So
I've moved.
We're not here. Okay.
I've moved on to the next person who's here. So the next person, unfortunately, I don't think Cole is available at the moment.
So I saw something in the chat that Cole said they were here to support colleagues.
Okay. Thank you very much. I'm sorry for the confusion. Butterworth, when you are ready.
Okay, hello, can you hear me?
Yes, I'm going to start the clock. It'll appear over here. Thank you very much.
Okay, hello everyone. My name is Butterworth Gobena, and currently I'm working as a public health researcher and a lecturer at University of Gondar. And my path to public health starts from a small town in Ethiopia when I saw my grandma was sick and she has COPD and she was very sick, and I was like, what could I do? I was a child and I can see that there was no facilities near our home. It was very far. There was no transportation. And I planned to study medicine, but unfortunately, due to some circumstances, I couldn't get into medicine. Then I but I continued to study public health and I became a public health officer. But as I have grown up, I can see that not only services, but there was also an issue with connecting the public or the users with the service. So we need mostly public health a decision that is driven by data. So that's when I realized that we need more new information, more new data, so that the policymakers can actually know what is on the ground and what the people actually need, instead of getting the information from other sources. So I start to realize that we need the information that we can generate, not from other sources, but from us, Ethiopian data to Ethiopian solutions, to Ethiopian problem that we can solve the problem. So then I make myself learn data science, and I start to do some new things, and I start to produce some new projects that work with predictive models, so that patients that cannot access highly specialized diagnostic tests can easily see whether they are at risk or not, and they can easily access health facilities and prevent some highly dangerous diseases like diabetes, especially it's currently being prevalent. Then I start to see that a person alone cannot make great change, so we need a team. Then I start to teach from my undergraduate classes, and I form a club that teaches health students with technology, so that they can learn new things, how to read research, how to utilize research. So even medical students, then we form a club. Now currently we are only females, so I have under me 15 female students, and they learn many new things. I hook them up with new technologies, and they can learn and they can understand different research, so that when they go into health facilities, they can actually make change, not only translate the researches, but they can actually generate new things. And also currently I'm working as a country vice president for African Public Health Students Health Network, and we mobilize different resources for community reach out programs. They can take and we teach the community, especially regarding antimicrobial resistant diseases and so on. That's currently highly epidemic in our society right now. And I would like to ask everyone here, when we go off from this panel, we can connect and we can make change within Africa. It shouldn't be this one-time thing. Then we can connect and let me know and write down your emails, so we can make change and we can go forward and solve our problem by ourselves. Thank you so much.
Thank you. Thank you. Oh, and I hit an effect with clocks. So thank you very much. We'll put you back to being an attendee in a moment, but I do want to call up Dr. Omotola Gordon Rose. I inadvertently skipped you earlier. I'm going to promote you to panelist. And I will restart the clock.
So I think the person we still have is our last speaker. So if we can remove that one.
So it just takes there's a little bit of a delay, I've noticed. Sometimes folks are there. There we go. And Dr. Omotola, if you are ready, we would love to hear from you.
So I think that person has declined. I think moving forward, what we can do is we can have, so once we call your name or we put your name in the chat, let us know that you're actually here and you're ready to pitch. So then like we can move forward a little bit more efficiently. So next person.
So the next person on our list is Gertrude Jepachirchir.
Let's see if that person here, Gertrude, are you here?
Yes. Gertrude, we have you promoted with ability to speak. And you're on mute.
Okay.
Welcome. Let me restart your clock. Please.
Thank you, everyone, for this opportunity. So my name is Gertrude Jepchirchir. I'm a medical psychologist from Kenya. So I hold a bachelor's degree in medical psychology from Moi University School of Medicine, a master's of science in international public health from Liverpool John Moores University, and I'm currently a PhD candidate in psychiatry and mental health at the University of Cape Town. So my work focuses on developing innovative, technology-driven, and culturally responsive mental health solutions for the underserved communities. So my key interest is in addressing mental health challenges among populations affected by gender-based violence, technology-facilitated gender-based violence. Since here in Kenya, we have a lot of embrace on the use of social media, either in academia, in businesses, like day-to-day life, and also social marginalization. And I use approaches which combine both community engagement, digital innovation, and public health research. So my path to public health, so my journey into public health was shaped by witnessing how structural inequalities limit access to mental health services, particularly in the marginalized communities. So here in Kenya, we have communities in the ESOL region, that is arid and semi-arid lands, which face chronic underinvestment, limited health infrastructure, geographic isolation, and shortage of trained mental health professionals. So many of these communities are also very patriarchal. So we have women who experience gender-based violence and trauma, and often cannot express themselves openly because of the discrimination. So in 2024, I spent a bit of time in this region speaking with women and youth survivors of gender-based violence, TFGBV, and substance use. So I did this in small community centers. They shared their powerful stories of trauma, online harassment, and social exclusion. So coming back from those communities, the first time I met them, actually they had to cover up fully with only their eyes visible because they had the fear of being identified by other community members. So listening to their experiences, it made it clear that traditional mental health systems were not reaching those who needed them the most. So that was my key then in coming up with interventions which were best suitable for them. And my idea is here in Kenya, we have so many policy briefs, so many papers and research findings that we've documented, but then my thought was, who will be on the implementing side? So first, what I did is I designed a community-embedded training program that provided accessible mental health education and psychological coping skills. Luckily, I had some partnerships with one foreign government and also the government of Kenya through its two stakeholders. I will not mention them at this point because I did not get their consent. So these included me coming up with training modules to teach these communities on how to cope with mental health and psychological problems. Secondly, I established mental health support desks, which function as both physical and digital access points to survivors of GBV, TFGBV. So these desks are providing counseling services, referral services, and guidance. And then thirdly, I co-created with the community members by ensuring programs are designed with the people they serve. And at the moment and as of yesterday, we've now brought in an AI program to help us with service delivery in these communities. And I'm happy because we have the foreign government funding this AI program. We have over 10,000 youths who've embraced it, and now they are helping roll the programs to the community members. So the key accomplishments that came from these were: one, I trained and supervised over 10,000 women, youth, and persons with disabilities in community-based mental health support. I also developed an AI-supported community mental health training module that expanded access to psychological support in underserved communities. I have also established cross-sector collaborations with law enforcement and community institutions to strengthen responses. Oh, my time is up.
Your time is up, but thank you so much. You're very accomplished, very much. So, so thank you. I'm gonna make you an attendee, and have brought Godwin up. I'm gonna ask you to unmute, and are you able to join with your video?
Yes, I can.
There we go.
Can you
Wonderful.
see me now?
I can. What I'm going to do is I'm going to restart the timer.
We lost you for a second with your camera. There you are.
Excellent. Welcome. So when you're ready. Godwin, are you there? You're breaking up a little bit. We can see you, but your audio is very broken up.
So I'm wondering, maybe it's my network. Maybe if I switch off my video, then the audio will be better. Can you hear me now?
Yes, we can. We can. In this case, we'll let it go. And let me restart your clock. It's I'll stop it at 4:55 because right now the clock says it's 5:05.
All right, then. Thank you so much. Sincere apologies for the network fluctuations.
These things happen.
Yeah, thank you. So my name is Godwin Lasisi. I'm a young public health professional based in Nigeria. I currently work with Sidani Group, a management consulting agency focused on strengthening health systems and reducing the zero-dose burden in the African continent, as well as advancing health system strengthening work across Africa and Southeast Asia. I also currently serve as a youth advisory board member to UNICEF Nigeria as a young public health professional promoting social and behavioral change in communities that are advanced towards immunization work. Currently, my main job focus in public health is health system strengthening through youth leadership, as well as the intersection of public health and climate change, known as the One Health Nexus. And so the question would be, what led me to this path of public health? I'd say public health first found me as a young person growing up here in Nigeria. I had my friends struggle with accessing healthcare services. I also had struggles accessing healthcare services, but I did quite understand what it meant until I went to university and studied health promotion and environmental health education, where I graduated with the first class and earned a BSc, right? And so the journey of getting into university and learning the understandings of public health made me come into this pattern and want to better make change in my community. And so as regards my experience and motivations that have shaped my career in public health, I'd say primarily it stemmed from being impacted firsthand by climate change and public health, and then wanting to make significant change as a young person. I'm 25 years old, and given the work that I've done in public health, young people like myself are better motivated to advance public health because they've seen the kind of work that I do. And that just keeps me going, just keeps on driving me. As regards the work and impact I have made so far as a young public health professional, I primarily work within community level innovation. Two major projects stand out throughout my career. First is within the immunization space, I have so far been able to ensure the vaccination of over 100,000 zero-dose children in consequential areas through an innovative GIS geomapping tool that was developed here in Nigeria. Second project was in Southeast Asia, in Nepal specifically, where with Sidani Group, I developed a tracking board, a financial database wireframe dashboard with Gavi, the Vaccine Alliance, right? So that was a major, those are two major projects that I've done. And as regards my work in the intersection of climate change and public health, I've been able to impact so far 20,000 children with the partnership with the United Nations Office on Drugs and Crime as a youth influencer, right? And so my work as a young person has so far sat at the intersection of public health, climate change, and social behavioral change through health promotion. And then when it comes to specific ways in which I have been able to advance my work with populations and communities that need them is through community-centric approaches, because my work majorly sits with the communities. As regards innovations and measurable outcomes, I've so far been recognized and awarded by the United Nations General Assembly representing young people in Nigeria. I've also featured on the European Union Diplomacy Week at COP31, advancing the special report on climate change and health with WHO. And also, as regards my publications and policy contributions, I've published work on the United Nations Office on Drugs and Crime work website, as well as their blog post. As regards why I want to be named as one of the 40 under 40, primarily, I think this award will better give me a platform to inspire other young people. It will help other persons see what can be possible through the work that I've done. I'm a young person who is just 25, and I'm trying to do so much work trying to impact change in my community. And so when young people can see that I can, and I've been able to do stuff like this, I believe that recognition will also inspire them to also make change, right? So I think for me, it's just the cascade effect of being empowered with change, being given a platform to talk about the work that I do, and then able to inspire change. I would say what distinguishes me, my leadership and contributions, will be the fact that I am a young person and I have the opportunity to impact future generations because I'm in tune with them. And what I would hope to achieve next in public health, I would say that would be specifically a groundbreaking idea I'm working on in partnership with the United Nations Office on Drugs and Crime, the Youth for One Health project, which has so far impacted 20,000 young children by educating them and giving them tools to advance climate change in their communities as it affects their health. And I think this award will greatly amplify my work and expand the impact that I've done as a young person in a community field of young people. Thank you so much.
Fabulous. Thank you. And yes, right on time. Our next speaker is going to be Ishmael Gumbo. I'm going to promote you to panelist and allow you to talk. And I'm going to reset the clock.
Hello, can you hear me?
Yes. There's a bit of an echo, but it's okay. If you can come off camera, if you could come on camera, that would be great. Whenever you are ready. Ishmael, are you there?
Let's go ahead and move on to the next.
Okay, let's do that. Next up is Joshua Algua. Joshua, I'm going to be promoting you to panelist and allow you to talk. And I'm going to be restarting the clock just momentarily. When you are ready, please begin. And if you could come on camera, please.
Can you hear me?
Hello, welcome.
Can you hear me, please?
Yes.
Thank you very much. So my name is Joshua Aluga. I'm the Managing Director of Equest Strategies, Nigeria. I am also a final year medical student from Ahmadu Bello University. So I work as a health policy advocate and also a communications professional I've been doing this for the past 7 years, and most of my work is currently around youth engagement, basically. And I've worked with, basically from the grassroots level, I've worked with a medical student association when I started with Nigeria, and also with in African region, and also internationally. And I worked with the United Nations associations, and also currently acting as the managing director of research. But this didn't just start this way. As a medical student, most of the time, I've seen a lot of issues around healthcare access among people. I saw the issues of affordability in healthcare, and all people don't have access to healthcare, and most of them will have to travel long distances. Apart from that, I also realized that people will have to maybe solicit for funds before they could pay for healthcare. So those are one of the major things that inspired me to start a non-profit organization, which I'm currently managing as the managing director of Equity Strategies. We currently have reach in about 6 countries in Africa, from Nigeria, Ghana, and Kenya, Rwanda, and also we've had reach in also up to Sierra Leone. Now, and so far over the past 2.5 years, and we were able to organize one of the first youth health financing forum in Nigeria, where we brought about 200 youths and different stakeholders to discuss about health financing. That was the first we ever had in the country. I was part of those that organized the first policy and advocacy and work and training over the span of 3 months, while I was still working in medical student association. And also apart from that, I went to the African region, where I had the chairman for the Policy Advisory Council, where we had a network of over 10,000 medical students across Africa from different countries. We were able to develop over 20 policy documents. And at the international level, I've worked on certain documents also that represent the views of over 1.3 million medical students worldwide. And currently, I've also, last year, I've worked with the World Federation of United Nations Association, organized the first physical global model WHO in Geneva, Switzerland, where we had over 350 delegates from over 52 countries worldwide. And subsequently, as the back as the managing director in Nigeria, we was one of the first, or we're even the one that started youth engagement in health financing in the country from our youth and financing forum that we organized. We also organized a robust 5 months workshop for young professionals across the country, where we had over 1,000 applications and trained over 60 young professionals across the country. And these are some of the impacts that I've made from the work that I do. Now, and apart from that also, and one of the reasons why I believe I should be chosen for this is because of most of my work. To add to visibility, to make and to inspire other young people to see the great work that we are doing as an organization, and be inspired to work towards health system strengthening, which is something that has been neglected by young people basically in the African region. And I believe that will go a long way in inspiring them. So, and that's all about me. And thank you very much for the opportunity.
Thank you very much. So next up is going to be Isaias Benninger. I'm going to promote you to panelist.
Unfortunately, I'm not going to be able to put my video, but because of the connectivity, but I hope it's okay.
Yes, if that's not possible, then
yeah,
it's not possible. So I'm going to restart the timer. It's playing its little song at the moment.
No worries.
Stop that. Thank you. So please, when you're ready.
Thanks. So thank you for this opportunity. So my journey into public health began with a question that no child should ever have to ask. So why did my siblings die? So I grew up in Chad, and when I was young, my parents lost 2 children before they reached the age of 2. So they died from infectious diseases that are today preventable. At the time, I didn't understand vaccines, health systems, or policy failures. All I knew was that something was wrong. Because these were not inevitable death, they were the result of systems that had failed. That realization stayed with me, and it planted a question that has guided my life ever since. What would it take to build a world where the place you're born doesn't determine whether you live or die? That question led me to public health. I left Chad to pursue my education, studying neuroscience and public health at the University of Kentucky, and later completing my master's and PhD in population health science at Harvard. But for me, public health was never only academic, it was personal. I didn't want to simply study health systems, I wanted to help change them. During my doctoral training, I returned to Chad and had the opportunity to serve as special advisor to the Prime Minister, becoming the youngest advisor in government. My work focused on strengthening delivery systems to improve public health outcomes. One initiative I supported was One Village, One Health Center, a strategy aimed at expanding primary healthcare access to underserved communities. Working inside government taught me something fundamental. Good policies don't save lives. Systems deliver those policies do. That insight has shaped everything I've done since. As a researcher, my work focused on adolescents and young people in fragile and conflicted affected countries. Populations are often invisible in global health policy. In many contexts, young people face barriers that go far beyond medicine, stigma, weak health systems, and services that were never designed with their needs in mind. So my research asked a different question. Instead of asking what services exist, I asked whether those services actually work for the people they're meant to serve. Through participatory research and health systems analysis, I work alongside young people to redesign services so that they're trusted, accessible, and responsive to their realities. But I also believe that youth shouldn't only be the subjects of research. They should be shaping the future of global health policy itself. This belief has guided my engagement in global leadership platforms. I've served as a member of the Youth Reference Committee of the African Union, the United States Foundation Partnership, and as a member of the Panel of the Future, an initiative designed to ensure that youth perspectives shape international policy conversations. I also serve as co-chair of the advisory group for the World Health Organization Global Action for Measurement of Adolescent Health, or GAMA. This initiative is helping define how the world measures adolescent health and well-being, ensuring that young people are not invisible in global health data systems. Across these roles, my goal has been consistent: to bridge these worlds that too often remain disconnected: research, policy, and implementation. Beyond academia and policy work, I've also worked with organizations such as the World Health Organization and UNICEF to strengthen health system and support large-scale delivery initiatives. And increasingly, I've turned to social innovation, co-founding initiatives that expand access to safe drinking water, develop digital health tools for frontline health workers, and explore new models of primary healthcare delivery designed for underserved communities. Across this experience, I've come to believe that the greatest challenge in global health is not discovering solutions. We already know how to prevent many of the diseases that claim millions of lives each year. And that required, the challenge is ensuring those solutions actually reach the communities that need them most. And that requires leadership that can operate across sectors, across research, government, and implementation. That is where I have focused my career. From local communities in Chad to government reform to global health policy platforms, my work has been driven by a simple mission: to help build health systems that deliver dignity, equity, and opportunity for the next generation. We must redesign systems. We must ensure that communities are not only heard, but that their priorities shape the services that they receive. And we must build institutions capable of delivering health and opportunity at scale, because no child anywhere in the world should have to ask the question that began my journey: why did my siblings die? Public health exists to ensure that question becomes a thing of the past. And that is the future I'm working to help build. Thank you.
Thank you. Thank you. Next, we're going to have Kate Okere. The timer's singing its little song. So Kate, I'm promoting you to panelist. And I'm going to reset the clock. So whenever you are ready to begin.
I would like to turn on my video. Okay.
Yes. Are you able to turn it on now? I can see the tree.
Yeah, that's my profile picture.
Yes.
Or I can see the option to turn on my video.
Oh, okay. You should be able to now. Are you able to turn it on now?
Yes.
Oh, fabulous.
Yeah.
Thank you. Whenever you're ready to go.
All right. Hello, everyone. My name is Kate Okore, and I'm a health communication strategist based in Nigeria. I'm a health communication strategist based in Nigeria. I'm also a proud 2023 Thought Leadership for Public Health Fellow with the incredible team here at Boston Congress of Public Health. I have a bachelor's of pharmacy and a master's in media and communication. So my work sits at an intersection of health systems, media, and community, and specifically interrogates how the stories that we tell about health either open doors or close them. My part to the work that I do in public health started behind the medicine counter as a pharmacist. However, my current public health focus on communication was more of a necessity rather than a career plan. So I grew up with an untreated refractory error. So my parents didn't know what was wrong. I also did not know what was wrong. So it wasn't until I got access to the internet as a teenager that I found the answers and eventually the treatment options. It never left me that the quality of my life suffered so much for something that could have been solved with a pair of glasses that cost less than $4. By the time I was ready to get treatment, I spent well above $2,000. So my story is not unique. About 1.1 billion people around the world, they are living with a vision impairment that could have been prevented or treatment. And this is also costing the global economy too. So moving on, to be honest, I've never stopped thinking about this. So my public health journey fully began as a medical content writer, then as a journalist. In 2022, I joined the Continental News Distribution Platform as one of its pioneering climate reporters and its only female delegate. In this position, I helped secure over $30,000 in grants to send African journalists to the United Nations Climate Change conferences. These events are historically marked by low African representation due to funding and visa barriers. So our goal going for these conferences was simple: make sure that the few Africans present had a platform. In recent times, I've made a deliberate effort from documenting stories to driving change on the ground. So last year, I joined Help Mom, a social enterprise using artificial intelligence and low-cost technology to reduce maternal and infant mortality. So I joined Help Mom at a critical moment. My job was to lead communications for the adoption of VaxBot, a vaccination chatbot developed under the $12 million Vax Social initiative that was led by Gavi, the Vaccine Alliance. When you look at the numbers around zero dose children in Nigeria, you would see the importance of this intervention. We have about 2.2 million unvaccinated children. I had little time to do the work that I was employed to do at Help Mom from the start. So there were two things that I needed to achieve through this work: drive adoption and push for government buy-in. So from the start, I knew that any communication strategy that excluded the very mothers that we were trying to reach would fail. And if we wanted Nigerian women to trust this tool, we needed people like them in the room while we were shaping this message. So I'll just wrap up by saying within months of implementing the communication strategy, VaxBot, which is the vaccination chatbot developed by HelpMom, scaled to over 11,000 unique monthly active users. And I mean, this was a proof point for us among other milestones that helped secure a $250,000 multi-year grant. I mean, context matters. So the organization has been on track for a $1 million funding from USAID, which it lost following the dismantling of the agency under the Trump administration. So this funding came at such a pivotal moment.
Thank you so much. We're
We're
gonna have to move on, but that was great. Thank you so much. And next up we have Ishmael. I know you had some issues before. We'll put you through to come up and talk. If you're able to come on screen, I'm going to restart the clock.
Hello, can you hear me now?
Yes, yes, we can. We
Okay,
can't
apologies.
see you. Yeah.
Okay, let me switch on my video.
Okay.
Okay, I don't know whether you can see me now.
Yes, yes. Thank you very much.
Okay, thank you so very much. I think you can restart the time. Yeah. Okay, can I proceed?
Yes, please.
Yes.
Can I proceed?
Please, please.
Sorry, I'm having connectivity issues.
Oh.
My name is Ishmael Gumbo. I'm a public health scientist from Zambia. Of course, I'm a published health researcher and currently acting as the executive director for a grassroots non-governmental organization in Zambia called Scientific Initiative Zambia. Now, I would like to put to you that every 15 minutes, a child in sub-Saharan Africa dies from an infection that was once easily treatable, not because medicine does not really exist, but because the bacteria or the causative agent really has outwitted us. Now, in this case, I have dedicated my career to ensure that Zambia and Africa at large really just has the data, the research, the people, and the systems to fight back. And the major concern that we are currently facing right about now, as far as public health is concerned, has to do with antimicrobial resistance. I'm currently pursuing my dual postgraduate training. That is a Master of Science in Epidemiology and also a Master of Science in Health Informatics. So this combination is intentional because I believe the future of public health in Africa must be anchored in rigorous epidemiological science and, of course, an aspect of data systems that inform real-time decision-making. As a public health author, I have 4 registered systematic reviews on Prospero. That is the International Register for Prospective Systematic Reviews. And of course, these reviews pretty much, I believe, focus on critical public health issues that are affecting low and middle-income countries, including infectious disease control, health systems, performance, and population health outcomes. Now, in 2019, I co-founded and now serve as executive director, as indicated, at what we call SEEDS, which is the Scientific Initiatives for a Healthy and Developed Zambia. Okay, because we believe in planting seeds of science, innovation, and leadership in communities that need them the most. SEEDS operates as the intersection of science, technology, and community-driven development, with a focus on empowering the young scientists, the students, and the communities to actively participate in solving public health challenges. Of course, our work reaches the youth, the women, and of course certain underdeserved populations across Zambia through different pillars that we can speak around, including community health engagement and education. Okay, we have youth capacity building. Okay, and the third one, we are looking at sustainable works for health education and environmental protection programs. Of course, through these initiatives, we have realized that this organization has grown into a youth-driven platform for evidence-based public health innovations in Zambia. Let me quickly go on to why I belong to the 40 under 40. You see, the mission of the Boston Congress of Public Health to democratize public health through equity, inclusion, and social justice is not just theoretical to me. It is lived reality of the communities I serve. Okay, I'm a data scientist who spends time in communities, a researcher really who translates findings into public health actions, and of course a young African who has refused to wait for systems to change, and instead I have begun to build one. Of course, being recognized in the BCPH 40 under 40 would not only validate the works that I'm doing, but also it would amplify the voice of young public health leaders, of course, the community advocates, and of course, emerging scientists across Zambia and across Africa. And I'm committed to being part of the future as the core values that you put under this BCPH 40 under 40. Thank you so much.
Thank you so much. Thank you. And I'm glad we were able to overcome the technical issues. Next up is Maxwell Okoth. I'm promoting you to panelist and allowing you to talk. I'm going to invite Ishmael to go back to being an attendee.
Can you hear me? Hello?
Yes, yes. I'm going to restart the timer for you. If you can come on screen, that would be ideal.
That's what I'm looking for to do the join us panelist. Okay. Just 1 minute, I see where. I can't see where to come as a live.
Yes, you should be able to.
Your camera is not on currently.
There you go. You should be able to turn on your camera.
Join the panelist.
You see it now?
But I'm trying to navigate. Join us, yes. Works. Can you see me?
Can't see you.
Interesting, because there's no option.
Given the sake of time, Maxwell, would you just like to begin?
Yes, yes. Don't worry about it. Yeah.
I go without. Can I proceed?
Please proceed. Yes.
So my name is Dr. Maxwell Okoth. I'm the founder and group CEO for RFH Healthcare, a company that I started 12 years ago. Basically, my path starts back as an intern in a medical facility in Kiambu, outskirts of Nairobi town. At that point, I started my internship in the obstetrics gynecological rotation. And the stark reality on the ground hit me when we only had one surgical theater and would wait for cold emergencies to turn into real-time emergencies because we had to choose between a mother in labor who needs a cesarean section and a gunshot wound. We were meant to play God and decide who do we take in and who do we leave out. And so with that stark reality and basic things like common ultrasounds would be booked 6 weeks down the line, you find a patient or a baby with a cord round neck comes for an ultrasound. 6 weeks later, you find it's an intrauterine fetal death. Those realities led me to start a healthcare facility whereby I started a small clinic called Ruai Family Hospital in the outskirts of Nairobi. 12 years down the line, we have 11 hospitals, a 300-bed capacity. We see about 300,000 lives annually that we save, and we have impacted 2 billion patients over the past 1 decade. Nearly half of the world's population still lacks access to essential health services across Africa. Over 40% of all health healthcare spend comes directly from patients' pockets. In Kenya, over 70% of cancer cases are diagnosed at cancer field. I would request that you would have restarted as I continue. So with that said and done, we set RFH apart is not just as a scale of care, it is how we have structured it. We have pioneered a model of financial innovation built on cost leadership and differentiation, delivering over 10,000 births, running more than 100,000 dialysis stations, and creating fixed surgical packages with minimal co-payment, all at a social health care rates. We employ over 500 full-time employees with visiting specialists and part-time clinicians, making RFH one of the most significant private healthcare employers in peri-urban Nairobi. We operate on a 4-pillar system. So our 4-pillar systems is where we have clinical care, we have the hospitals, we have set up one of the best and fast comprehensive cancer care centers in sub-Saharan Africa. We are the first to start lutetium-177 therapy as a nuclear medicine targeting prostate cancer patients and holistic palliative care. On the second part is our workforce development, where we have a medical training college called John Charles Medical Training College. In the past 3 years, we have had 250 plus personnel trained and deployed locally and across the globe as far as Canada, Australia, and Netherlands. Our third pillar is community prevention, whereby we have the RFH Foundation. RFH Foundation sorts the gaps in patient navigation, support, subsidized transport, fee screening, and community outreach. We transform episodic care into continuity of care. The distinction is the difference between a health system and a health service. The fourth pillar is our financial protection model, where we run a Redleaf medical insurance. We have deployed US dollars, a premium of $270 for a family of 3, and we have paid premiums of over 1 million shillings of medical claims in the past years. The fourth one is our corporate social responsibility. Should I continue? Because of time, I think mine was not set.
No,
so the fourth one is corporate social responsibility. We believe that. Sorry?
No. You asked if you should continue going, and I said yes.
Yes, so we believe that a private healthcare business operating in underserved communities carries a responsibility beyond its balance sheet. RFH is a tax-paying corporate citizen contributing directly to Kenya's revenue base. Through the RFH Foundation, we are championing access to cancer care for communities that cannot afford it. We realize that cancer care is not just diagnosis, is not just having the equipment, but most patients in cancer care are lost to follow-up. Because when you start radiotherapy, for example, you need to they have sessions almost over 30 days. Some of these patients cannot be accommodated. That's where the foundation comes in to take care awareness, free screening.
Mohammed, thank you. We have to keep moving. Next up is Mohammed. I'm going to be allowing you to talk. Making you a panelist so you'll be able to share your screen. I'm also going to be restarting the timer. And thank you very much, Maxwell. Mohammed, are you there when you're ready to go?
Hello?
Mohammed, when you're ready
Yes,
to go, please do. Yes.
Yes, can you hear me?
Yes.
Can you see my screen?
I cannot see your
Can you
screen.
see
No.
my face actually?
I can see, no, we can't see anything. So just
Hope
for
you can see me now.
for the sake of time,
Yes.
there we are. We can see you going. There you go. Please, when you're ready.
Okay. Okay. Hello, everyone. Thank you so much to give me this opportunity to participate, present the 40 Under 40 Patch on Public Health Catalyst Award. My name is Mohammed Talib. I have a baccalaureate degree in Public and Environmental Health, qualifying degree in Epidemiology, and I have a master's degree in Public Health. I am now working with as a Public Health Informatics Fellows at Africa CDC, Health Agency of African Union. I'm in Zambia now, working in Zambia National Public Health Institute to support mortality surveillance and strengthening routine mortality surveillance in Zambia. My public health journey and vision is during my working in conflict-affected area in Sudan. I was moved to working across different regions. I was witness that the gap is fragile health system and as a profound challenge as communities face it in accessing basic healthcare. So this is experience not only shaped my career, understanding of public health, but also it's fueled me to commitment to improve health delivery and vulnerable understand the underserved population. Today, I am work with Africa CDC. I focus on strengthening public health intelligence and digital system. My vision is to build baseline technology, enable health system across all Africa, and empowering health worker, and also to improve health delivery for every community. The key experience that I have also shaped my career, that I have been working in the fragile and underserved communities across Africa, where I observe how health system often struggle to respond quickly disease outbreak. I believe that justice and equity most of the central of every public health initiative. My work actually is focusing on addressing health inequalities in fragile and underserved populations, where access to quality healthcare is often limited. I also leverage digital tools and data-driven decision-making to improve access care and support equitable allocations of resource. So this work, I strive to build a local capacity, empowering health worker and communities, and also advance more inclusive resilient health system. Actually, my work and impacts focus on strengthening public health systems in fragile and underserved communities across Africa, particularly in conflict and affected resource limited settings. Also, I conduct during this impact. Also, I conduct important research on the descriptive epidemiology of cholera outbreak in Sudan, providing critical slides to guide outbreak control efforts. Also in 2024, I evaluate neglected tropical disease surveillance system in Sudan, and I recommended introducing a digital platform to integrated health facility. And also to community reporting should be a real-time data and sharing the improved outbreak preparedness. During my professional journey, I have contributed to the development of general policy during the conflict in Ethiopia and Sudan to facilitate the delivery of movements of health service and internally displaced peoples to supporting continued access to essential health care. I am active in my community, different community in Africa also to promote democracy and justice, reflecting my commitment to equity and health in society. Actually, I would like to be named of one of the 40 under 40 PH Public Health Catalyst Award, because I am dedicated to advancing public health, equity, justice across Africa. Most fragile, underserved community, my work is driving to be commitment, creating sustainable health solution to improve community and addressing system in different disparities of different community.
Thank you. Thank you very much.
Thank you.
Fabulous. We're going to next have Nyeki James Tony. When you are ready, you should be able to see your...
Hello, I think I've unmuted myself. Can you see me?
I can see you. Yes. And you have been promoted to panelist, so you should be able to share your video. And I'm going to go over here and start your... Are you able to start your camera? Okay. Okay,
There you
and I
are.
see your video. There you are. And here's the thing. When you're ready to start, we're happy to hear.
Okay, thank you everyone for giving me the opportunity to present to you my pitch on this 40 under 40 or the Boston Congress of Public Health Catalyst Awards. My name is Nyeki James Tony. I'm a Cameroonian public health practitioner, microbiologist by training, and currently practicing as a biological risk manager in the Gambia. My career began as a laboratory technician at the Buea Regional Hospital in Cameroon, where I strengthened tuberculosis diagnosis and treatment and championed the adoption of a digital health system for the which facilitated patient registration, transmission of results, and treatment follow-up. I also practiced as a zone coordinator in public health with a tuberculosis reference laboratory, Bamenda, under a project funded by the Stop TB Partnership, closing healthcare gaps in tuberculosis diagnosis in Cameroon, where I strengthened the intensified case finding initiative by the institution. I mobilized community health workers in this project and trained them on TB screening, and as well as community health facility nurses and doctors and other health practitioners. I also introduced the digital health application utilization in these institutions. I later on practiced as a quality assurance corp with a global health system solution funded by PEPFAR in Cameroon. I implemented a laboratory quality management system across 7 health facilities in 4 health districts in the south region of Cameroon, where I mentored health workers, laboratory technicians, and doctors and nurses at patients' entry sites on diagnosis and screening for HIV and other laboratory tests. I also implemented a sample transport network where bikers and other sample transporters moved into community health facilities, collected samples, and brought them to point-of-care testing sites, and therefore strengthened the testing of underdeserved populations, those who are not in the urban centers. I then moved over to the Gambia, where I'm currently practicing as a health and safety advisor, biological, the biorisk manager, and the chairperson of the Biological Safety Committee at the Medical Research Council in the Gambia at the London School of Hygiene and Tropical Medicine. My work here is to ensure that cutting-edge research involving clinical trials and other public health initiatives are carried out safely without infection to the staff carrying out this research, and without affecting the population, the external community, as well as the patients who are involved. I have also extended through this same position my reach to Nigeria through the CEPI-funded Aqua project in the Lassa fever virus clinical trial site in Uwo and Bauchi. We have implemented the utilization of a mobile laboratory, mobile clinical trial units there, which is currently functional. I have also had a tenure year as acting head of health, safety, and environment for 1 year, where I have also strengthened the health and safety aspect of in the construction of a containment level 3 laboratory, which is going to strengthen disease surveillance and research in the sub-region. So to be selected in this 40 under 40 will help me connect with peers across the world to share my experiences, and also to highlight my achievements to junior career people who are working in public health, to motivate them, and also scale innovations through strengthening systems and in public health and in sustaining lives. I am committed in the advocacy for equity, resilience, and global health security. Thank you.
Thank you very much. Next up, we'll have Olubi. Let me move you here.
Hi.
Hello. You should be able to share your screen, as well. Yes, or share your video, excuse me.
I can, okay. Show my video. I don't know. Okay, let me see. I can't see that option. I don't have the option to share the video. Okay, let me see. Oh, no, I see panelist. Okay.
Okay, fabulous. All right, so let me do that real quick. Here we are. And when you are ready to go, we will be happy to hear.
Can I start?
Yes, please.
Okay, thank you so much. Good afternoon, everyone. My name is Dr. Laniro Olabi. I'm a Nigerian physician and health system architect. and global health innovator working to redesign how equity is delivered, financed, and sustained across Africa. I do not choose one lane in public health because inequity does not exist in one lane. I have worked in rural clinics, correctional facilities, faith-based outreach programs, psychiatric clinical trials, national policy meetings, AI laboratories, and global academic institutions. Across every one of these spaces, I saw the same structural pattern. Fragmented systems produce predictable injustice. So I chose to build integrated ones. In Nigeria, I led clinical and outreach operations across multiple NGOs and community programs, from Harvest Field Foundation to Pre-Diagnosis International, delivering mobile medical and minor surgical services in underserved communities. I was honored as the overall best outreach coordinator early in my career, but what mattered more was learning that charity without structure does not endure. That lesson shaped Olan Healthcare, the primary care platform I founded. Through Olan, we have delivered 100 medical outreaches and coordinated more than 100,000 screenings. But beyond outreach, we built referral architecture, community workforce pipelines, and financing models that shift care from episodic to sustainable. In Uganda, I led the implementation of EEG diagnostic services for epilepsy in a rural district, integrating disability care into primary health systems. But we did not stop at diagnostics. We formed a 10 to 20 village community support groups and launched a pig rearing cooperative financing model for families to fund sustainable treatments. That work became EpiCare, an approach that integrates diagnostics, stigma reduction, economic empowerment, and AI-enabled support care to one equity framework, because equity without financing collapses. At the policy level, I engaged directly with the Ministry of Health in Nigeria and Chile and co-authored research in Lancet Oncology examining structural imbalances in global health financing. My cardiovascular financing study demonstrated that although cardiovascular disease causes 20 million deaths annually, primarily in low and middle income countries, it receives only 0.008% of development assistance from 2007 to 2023. That is not just underfunding, that's architectural lag in global parity alignment. At the Innovation Frontier, I serve as a clinical research fellow at Paseo Lab, developing AI-driven surgical intelligence systems like CardioVis technology that embeds real-time decision support into robotic cardiac surgery to reduce variability and improve safety. Our work earned IEE Best Paper Award and selection into the Harvard Health Lab Accelerator and MIT Innovation Ecosystems. For me, artificial intelligence is not hype, it's equity quality when developed ethically. As a scholar, I have authored and co-authored peer-reviewed research across telehealth, surgical systems financing, and global oncology, including publications in Lancet Oncology, the Pan-African Medical Journal, and multiple international journals. I have served as a peer reviewer for PLOS ONE and other journals, contributing to global standards of scientific rigor. As a system leader, I coordinate the Nigerian hub for the Harvard Health Systems Innovation Lab Hackathon, building innovation pipelines between Africa and global institutions. I have moderated multiple sessions at American Public Health Association annual meetings, co-chair at the APHA HIV/AIDS Communication Committee, and completed executive leadership training through Harvard's Public Health Leadership Lab with performance above 98th percentile. I was honored with the Garrett Green Award of Excellence for Public Health Practice at Harvard University and the MCH Leadership Lab Award, recognitions that affirm not academic achievements but transformative system impact. I'm also an activist academic fellow with Fenway Health, working on climate justice, health equity, and violence prevention, because public health justice must be intersectional. So why should I be named under 40 under 40? Not because I built one program, not because I published one paper, not because I won one award, not because I have been in multiple systems, but because my work integrates clinical delivery, disability inclusion, mental health systems in one current architecture for health equity. I do not build projects, I build systems that endure. Thank you so much, and a privilege to present. Thank you.
Thank you. Thank you. So next up is wonderful. Next up is Olo Wushola. I'm going to promote you to panelist and allow you to talk and turn off this and restart the timer for you. So you should be able to share your screen.
Hello, everyone.
Hello. Let me start the timer. Here we go. And when you are ready, we're happy to hear.
Can you hear me, please?
Yes, we can.
Okay. Thank you very much for the privilege. I am Oluwashola Balogun from Nigeria, and I am a public health professional. I work as a program manager, adolescent and youth on health and rights. So I also have my postgraduate studies in health promotion and education, where I have actually been functioning over the years. So I started off as a peer educator, and that's because I noticed that young persons like myself actually look for information from people that they are very familiar with, most times from peers, and there are so many questions to be answered. So that's why I actually work in that sector, and I have been able to build a career in that area. I founded She's a Leader, a platform that works on actually achieve something, and they can be leaders. Young women can be leaders. So aside focusing on young persons, I specialize with young women and girls. Okay, I have also worked on multiple projects in the organization I currently work with, which is an NGO, and I also work with the ILO. I work with WANEP Nigeria. I was the immediate past Southwest Zonal Coordinator for WANEP Nigeria under the Young Women Lead Arm. And I have also used my social media platforms to promote health education for young people, answer questions that might face young people from the public health perspective. And I also have worked on different projects such as SIYB, that Start and Improve Your Business, where ILO trained some people to be business personnel, and I was privileged to be one of the consultants that were picked to be on the project. So I worked with ILO on that project, and we were able to equip over 1,000 young people with startup equipment to build their business, which is something that actually resonates well with me, so long as it affects young people. And recently, I won an award. That's December last year. I won an award I won an award on the I won the best, sorry, I'm so sorry. I won the best award for young women in public health. I actually also won the Edith Lusubongo Award for the best female researcher, which is 2-in-1 award that I won on that particular International Conference Day. I also got the Outstanding Scientific Contribution and Excellence in Research Award by the Society for AIDS Africa. I also got a certificate on Outstanding Achievement, Exceptional Research Excellence, and unwavering dedication to advancing scientific knowledge and improving health outcomes in Africa. So these are some of the things that actually propel me towards helping young people to achieve their aim and their goal. So I would like to plead that I'm part of the 40 under 40 personnel, because it will help me to inspire more young people on how to do something good for themselves, how to pick themselves up from wherever they find themselves, answer questions that may apply to them, and also work together to make sure that people around them also have good impact and not just for themselves. Thank you very much.
Thank you. So next up is Opelope Jesu. So I'm going to restart the timer, and when you are ready to come on camera and speak, we would love to hear you. Are you able to share your? There we go. There we are.
Yes.
When you're ready.
Thank you. Good evening, everyone. Yes, I am. Okay, my name is Okwelokwe Suwulabi, a public health researcher from Lagos, Nigeria, a member of the Youth in Digital Health Network of the Africa Center for Disease Control, a fellow of the Latif Jakonde Leadership Fellowship. I've been privileged to work across different public health areas, and I'm currently focused on strengthening health systems at Farm Access Foundation. 8 years ago, I pivoted from the laboratory to public health research because studying diseases and their causes was not enough for me. I wanted to contribute to improving health outcomes and preferring digital health solutions for Africans. And this I've been able to do through different organizations like Farm Access, the Global Fund, ACMEA, AMREF, the National Health Insurance Authority, Grand Challenges Calendar, to mention a few. However, through my research journey, I realized that there are gaps that are deeply rooted in the healthcare system. And this motivated me to join the Leadership Fellowship, where I can better understand these gaps and see how governance and policies can be used in addressing the gaps. In strengthening healthcare systems through Farm Access, I've worked healthcare providers on a quality improvement journey that changed how facilities think, act, and improve. And I do this using a multi-step approach. Firstly, I conduct a quality healthcare assessment of facilities using the SafeCare methodology. This is an internationally recognized methodology for resource-constricted settings, and it was jointly developed by 3 organizations: Farm Access, Joint Commission International, and COSASA. This methodology has been accredited by ASCOA, and the methodology is very grounded in the Donabedian improvement model, which evaluates care through 3 key dimensions, which are structures, processes, and outcomes. Meanwhile, the SafeCare methodology extends way beyond the Donabedian improvement model by also assessing systems. After assessment of healthcare facilities, I generate and disseminate quality improvement plan, which is meant to be implemented in 1 year by these healthcare providers. So I walk the healthcare providers on this quality improvement journey using each of their plans through a gamified digital platform called the Quality Platform for Providers. So aside providing technical guidance, I've trained healthcare workers in implementing corrective actions. So beyond building capacities, mentoring healthcare workers, I've also built peer learning networks among the healthcare facilities such that they can cross-learn and learn from each other. In addition, I've also supervised the formation of quality improvement teams and structure in each of these healthcare facilities to ensure that quality is a shared daily commitment. Across 6 states in Nigeria, I've worked over 500 healthcare facilities on a quality improvement journey. I've trained 3,000 healthcare workers. And across all of these facilities, they've improved greatly as their governance and risk management are now strengthened. Their clinical and non-clinical processes are now well standardized, and there's been an improvement in their workforce capacity and their ability to use data in making improved decisions. I believe that my contribution matters for public health because it has helped ensure equity and justice. Because for every single one person who walks into each of these facilities, regardless of their socioeconomic status, they're walking into a facility that has been held to the same standard of safe, effective, equitable, people-centered, timely, integrated, and high-quality care. This is what my work is centered around. I believe that I should be named one of the 40 under 40 because I didn't wait for a policy to be formed. I walked into every healthcare facilities across the geopolitical zones in Nigeria and built quality improvements from the inside out. Through my leadership fellowship, I'm moving from improving facilities to influencing the governance architecture that determines whether quality improvement survives beyond any donor cycle. Going forward, I intend to ensure that quality improvement is embedded in the Nigeria subnational and national health system, such that every Nigerian is protected by the system. I believe that this platform, which is the BCPH 40 under 40, will place me in rooms where health policy is shaped. It's going to give my evidence a loud voice, and it's going to tell the next generation of African public health professionals that this work of strengthening health system, though it's quiet, it's not glamorous, it's actually worth doing. This award is not the destination. It is the platform I need for greater reach. Thank you.
Thank you. Thank you. We'll just change you to an attendee. And then next up is Jennifer.
Wonderful.
Jennifer.
Dr. LeCompte, I'll just like hop in there and say we've had such great speeches or pitches from all of you. We deeply appreciate that. So keep it going.
All right. Yes, yes. It's been very inspiring, everyone who's gone so far. Jennifer, I'm going to promote you to panelists so that you can share your video. And as you do that, I'm going to reset the clock. Are you able to share?
Yes, can you hear me okay?
I can hear you. Yes, yes.
Awesome. Hi, everyone, and thank you so much for the privilege to present. I have heard so many inspiring colleagues across Africa doing really good work. I like to say that I'm an accidental public health scholar. Public health was not always in the cards for me. I mean, although as a young girl, I wanted to be a gynecologist, working to support women to live healthier lives. But I became an environmentalist instead and created Susty Vibes, which is a nonprofit that has mobilized millions of young people across Africa to lead climate action in their community, albeit through a gender lens. And we've been very successful. However, 4 years ago, I, as founder, started to feel extreme overwhelm and burnout as a result of my work as a climate activist. And I realized that the grim realities of the climate crisis was also affecting our movement psychologically. We were grieving as young people a future that's not lived, that we've not lived, and we're feeling overwhelming anxiety about the state of the planet. So I turned to research to explore the pathways through which climate change impacts not just our mental health, but our health in Africa. I think the work that I do is necessary because we need to avert this looming public health threats that can impact even our social fabric. So I founded the Eco-Anxiety Africa Project, which is one of the first initiatives that is addressing the dual impacts of climate change on youth mental health. I also decided to go back to school to study public health, even though I had a master's in development studies. And today I like to say that I'm a climate activist turned public health scholar, working to really understand and validate the experiences of eco-anxiety and environmental related emotions in Africa. We know from our own experience that the climate crisis impacts us even a bit more than other parts of the world. And we feel a form of eco-anxiety that is unique to the African population. Our experience of climate anxiety is triggered by biodiversity loss, plastic and oil, injustice and pollution, as well as illegal wildlife trade. The work that I do is divided into research, community action, and space making. Through research, I'm building evidence to find out the unique experiences. One example is the Impact Project, which I'm currently leading as part of a Grand Challenges project in Canada, the UK, and also in Nigeria, working to understand the urban experience for young people. What does it mean to be a young person living in an urban area in Ghana and Lagos and experiencing mental health issues as a result of your broader environment? So think of heat strokes, think of noise pollution, think of sea level rise, flooding, etc. With community action, I'm also not just turning this anxiety into a problem, but also making hope, transformative hope for young people. So through tree planting and other activities, young people still feel that sense of agency. And through spaces, I've created something called Zen Cafe, which is one of the first of its kind initiative, bringing young people to talk about the contextual realities of being impacted by the climate crisis on a psychological level. My work has been recognized by the BBC, where in 2023, I was a BBC 100 Women for the work that I do, and also the National Geographic 33. But beyond these awards, I think I've been working to make a case for this intersection of climate change and mental health. It sounds very difficult to wrap your head around that this is work that needs to be prioritized, is critical. Africa, for example, has over 60% of its population as young people. So we need resilient young people. Knowing that climate crisis impacts us, it's really important that the work that we do is elevated. And I think that is what spaces like this award does. It raises my profile, raises my portfolio, and spotlights the importance of doing work in these spaces, work that supports young people, inspires particularly the medical and public health professionals to start to look at climate change as areas where they can create impact and support the young people, massive young people within the African population that they can work with. And I really want to say thank you for this invitation and this opportunity to share about the work that I do and to be considered for this Catalyst Awards. Thank you.
Thank you. Thank you very much.
Jennifer.
So wonderful. I'm going to go on to the next speaker. And then the sustains little song.
I actually love it.
It's kind of funny. So, but Samuels, you should be able to share your, share your video. Thank you very much.
Okay, can you hear me clearly?
Yes, we can. I'm going to reset the timer, and when you're ready to go, we're ready to hear.
All right, so thank you for the opportunity. So every day across Africa, patients die not because medicines don't exist, but because those medicines never reach them. My name is Samuel. I'm a pharmacist and healthcare operations leader from Ghana. I currently serve as a managing director for Med for All, which is a program under the Farm Access Foundation in Ghana, where I'm leading efforts to build a digital marketplace that improves access to essential medicines and strengthens procurement systems. My work generally sits at the intersection of health system strengthening, digital health innovation, and equitable access to medicines. For more than a decade, I've focused on solving one of Africa's most persistent public health challenges, which is ensuring that life-saving commodities reliably reach people who need them the most. I'd say that my journey into public health was shaped by both professional training and personal experience. As a trained pharmacist, I quickly realized that the biggest challenges is not a lack of knowledge of medicines or medical knowledge, but it was access. Essential medicines, blood products, vaccines, they often fail to reach patients because of many challenges, including supply chain gaps, infrastructure limitations, and fragmented systems. Also, a personal experience which sort of reinforced this push was when my family once struggled to find a basic medical device for my daughter who had a fractured thigh bone. It sort of reminded me how fragile access to healthcare is, even in a major city. I'll say that this conviction has guided my work across multiple African countries. I worked with a drone delivery company, Zipline, which was the largest autonomous drone delivery network, where I helped to scale one of the world's most innovative health logistics systems across multiple African countries, delivering blood, vaccines, and essential medicines. I'd say for vaccines in particular, during the COVID era, we delivered almost 3 million doses of vaccines in Ghana and other countries as well. I also had a lot of focus around strengthening operational systems and performance monitoring across our operations to ensure that we do 200 drone deliveries annually, which is actual drone deliveries that are actually going there to save a life because of an emergency of some sort. Today, I currently lead Med for All, which is an initiative designed to transform how healthcare providers procure medicines and medical commodities across many African countries. Fragmented procurement is a big thing. Stockhouses there, high prices. And so what we are basically building is a business-to-business marketplace, something like your Alibaba for medical commodities, which creates transparency, strengthening supply reliability, and creating access to essential medicines. I'd say over the course of my career, I've contributed to lots of initiatives which have served millions of people. I'm also proud to be part of the Atlantic Fellows for Health Equity, where I'm a 2024 fellow and now a senior fellow, helping to advance fairness and justice in health systems. I'm also an Africa CDC Youth in Digital Health, which was a cohort that I joined in 2026, selected to be part of the youth building a lot of knowledge around digital health on the continent. I'd say what distinguishes my work is a commitment to operational leadership in public health. And looking ahead, my mission is to help build resilient, technology-enabled health supply systems across Africa, systems where medicines are affordable, supply chains are transparent, and access to care never depends on geography. Being recognized amongst Africa's 40 under 40 in public health would provide a powerful platform for me to amplify the importance of supply chain innovation, digital health systems, as well as operational leadership in strengthening healthcare delivery across the continent. Because ultimately, strong public health systems are not defined only by policies or discoveries. It's not about the technology. It's not about all these policies. They are defined by whether care reliably reaches the people who need it the most. Thank you.
Wonderful. Thank you, Samuel.
Welcome.
I'm so sorry. Next, we're going to have Sanya. Thank you very much, Samuel. Let me bring up the
You guys are
talk.
making this challenging. That's all I can say. I'm furiously.
I know. I know. Just fantastic event and truly inspiring. Sanguin, are you able to share your screen or share your video? Excuse me.
Not as of yet. I can share my audio.
Here we go. Here we
Okay,
go.
there we go.
Fabulous. Let me reset the clock. And when you are ready, we're ready to hear. Oh, you've gone back on mute.
Thank you very much, and thank you very much for the privilege. Good morning, good afternoon, good evening, everyone. We often speak about public health in terms of vaccines, infectious disease, or primary care. Yet one of the largest and most overlooked global health inequities is access to surgical care. Today, there are more than 5 billion people all around the world who cannot access to safe, timely, and affordable surgery. My name is Sang-eun Lee. I was born in South Korea and now working as a junior medical doctor in Tawong in rural South Africa. Moving a decade ago from South Korea to South Africa gave me a sobering perspective on health inequity. The disparity in access to care was a genuine shock, and it drove me to ask, how can I catalyze change? My answer draws from a concept that I encountered in South Africa, which is called Ubuntu. It is an isiZulu and isiXhosa word meaning I am because we are. It speaks to the power of community and it shapes how I approach this work because I believe that the most powerful way to address these challenges is by engaging young clinicians and students in conversation about health systems, policy, and global equity from the very beginning of their careers, especially in low-resource settings like the one that I work in today. In my role as a clinician, researcher, and leader in global surgery, I've come across to understand that the barriers to surgical care are rarely just clinical. They are systemic. There's policy gaps, there's workforce shortages, and unequal access to leadership and educational opportunities. My work therefore focuses on two areas, that is health systems policy and youth engagement in global health leadership. On the policy side, I support National Surgical Obstetrics and Anesthesia Plan, also known as NSOAP. It is a national strategy to strengthen surgical systems. Through this work, we analyze policy performance, assess health system capacity, and support the integration of surgical care into national public health planning, advancing progress towards universal health coverage. But policy alone is not enough. Sustainable change requires a generation of clinicians who understand health systems and can drive equity and global collaboration. And this is exactly why I work extensively in youth leadership in global surgery. As the immediate past president of IASSS, the International Association of Student Surgical Societies, my voice was resonated by a network of more than 10,000 medical students and early career doctors across 100 countries. During my tenure as the president, IASSS was integrated into the International Society of Surgery, one of the world's prestigious organizations in surgery. We were also invited by the G4 Alliance, the Global Alliance for the Surgery, Anesthesia, Obstetrics, and Trauma, to represent youth perspective in shaping global surgery. Our most recent initiative, the Future Surgeons Program, invites students from low and middle income countries aspiring to surgical careers to the International Surgical Week, where they network, find mentorship, and step into the future surgical workforce of their nations. The impact of this work lies not only in research outputs, but in building a community of emerging leaders committed to health equity. For many of these students, these platforms provide their first opportunity to contribute to global health conversation that have historically excluded them. Most importantly, this work shifts the narrative of who shapes global health, from young clinicians and students as passive learners, and now to active contributors to research, advocacy, and policy. To me, being a catalyst means creating conditions where others can lead change. If selected for this cohort, I hope to expand platforms that support young clinicians and students, particularly from underrepresented regions, to shape the future of global health. Because progress will require not only strong policies, but a generation of leaders empowered early to drive them. Thank you very much.
Thank you. Thank you. Next up is going to be Amunyana. Thank you very much. And the timer's going.
Hello, everyone.
Hello, hello. You got like a little musical intro. Are you
Can
able
you see
to
me?
share your? I can't see you. Let me just check the. When you are ready to go, though, here we go. Try it one more time.
Can you see me now?
Yeah, it looks like it wants to share your screen. There we are. When you are ready to go, we're ready to hear.
Thank you. Hello, everyone. My name is Dr. Umunyana Marie Chantal. I'm a medical doctor and a public health innovator from Rwanda. I'm the founder and the managing director of Umubyeyi Elevate, a health tech initiative dedicated to advancing maternal, newborn, child, and women's health across the life course, from adolescent to menopause. My work sits at the intersection of medicine, digital health, and community-centered approach, translating complex medical knowledge into practical, simple day-to-day language, and also digital tools, safe spaces, and self-care tools that helps women and empower women to make informed decisions and take charge of their health. My journey into public health began from my personal experience as a young mom who got married, and I was still in medical school, and then I got pregnant. It's that time that I realized that women are not prepared enough, and also the healthcare system that we have is not understanding what women need. Through my clinical practices, it was a confirmation. I worked with mothers and I noticed that many women, many complications that they have could be treated in the hospital. However, they could be prevented with early and knowledge to make informed decision. That means many women delay care because they don't know, and also they can't recognize alarming signs. Women get married, they get pregnant, they deliver when they're not prepared, both mentally, physically, and it comes as a stress. Women were leaving health facilities with prescription, but without understanding. That realization pushed me to go beyond treatment and focuses on prevention, health literacy, and community empowerment, helping women recognizing risks earlier and make informed decisions about their health. Through Umubyeyi Elevate, Umubyeyi is a Kinyarwanda word that means a mother. So through Umubyeyi Elevate, we are building a hybrid ecosystem that combines digital health tools, self-care tools, community safe spaces, and workplace awareness program. Our initiative includes the B-Space, a community platform where women meet experts and they get to learn about their reproductive health, self-care, but also they get to share their stories through storytelling. We also launched a Menospark initiative, which was the first initiative in Rwanda dedicated to increase awareness around menopause, perimenopause, and menopause, breaking the silence around midlife women's health, and also reducing or eradicating the stigma around aging. We've developed self-care tool called the Mama Guide, a comprehensive reproductive maternal health guide, which is nationally validated, and it's one of its kind on the East African community that supports women through the journey from preconception to menopause. We've developed a digital platform that integrates our educational modules and also help women track their health even before they get pregnant and also receive expert support. Our program have been supporting hundreds of women and families who falls in between hospital care and community health services, bridging the gap through access to education and empowerment. At the heart of our work, there is a simple belief: every woman should understand their body and make informed decision for herself, and the entire family can benefit from that.
Thank you so
Over
much.
the past,
We have to go on to the next speaker, but thank you very much. That was a good ending point. So next up we have Usman. Usman, can you share your screen or share your camera?
There we go.
There we go. All right.
Can you all see me and hear me?
Can't see you just yet.
You can't
When
see me?
you can't see you, but just take a second to like jump on. I'm going to start the timer, but when you're ready, we're ready to listen. It's just keeping.
Okay.
Okay.
So,
Oh, you're echoing quite a bit, so just to let you know.
all right. What about now?
It's a bit stadium-esque. You're echoing a lot.
So
Try.
I'm trying to figure out what the problem is.
Okay,
Can you
just
hear me
we can hear. There you go. There we go. That's a lot better.
Okay.
There you are. Okay, great. When you're ready, we're ready to hear.
Okay, thank you so much. My name is Dr. Usman Shehu, and I'm a medical doctor by training. I'm also a public health physician. I'm also a field epidemiologist trained by the United States Centers for Disease Control in Nigeria. So my areas of focus is mainly the vaccines and immunization. I've been working over a decade in the providing vaccines, improving accessibility to especially areas of underserved communities, mostly children under 5 years of age. And we've done a lot, especially from the days of the Global Polio Eradication Program, which I have worked with extensively in northern Nigeria. And one of the key motivations of me joining the public health is right from my medical school training, where we have a lot of community components we have the community-based medical education and services program that exposes us right from the young stages of the medical training to the communities. We go into the communities and then we conduct community diagnosis, where we identify the commonest health problems in the communities, and then we try to provide interventions to reduce morbidity and mortality in the community. And then I have worked also in under the polio eradication program. I have worked in under the nomadic outreach project, where I worked in many states of northern Nigeria to enumerate populations in the marginalized communities, to have a database of where they are and where their children are. This is a major problem, especially in Nigeria, where polio has been a problem for many years, and it has been causing a lot of disabilities and morbidities and mortalities among children. And so I was able to have closer contact with the children, and then this really gave me a strong motivation to continue to work in the public health space up to today. And then at that time, we identify them, we enumerate them, we identify them, and then we vaccinate them. And then later on, recently, I work with Africa CDC at the West Africa Regional Office, where I oversee 15 West African countries, and where I support providing vaccines to address outbreaks and pandemics, right from COVID-19 and then to other outbreaks like Mpox and other vaccine-preventable disease outbreaks, cholera, measles, pertussis, diphtheria, and many more, meningitis, and the rest. And this is across the 15 West African countries under the Civil Lives and Livelihood project. This project was a $1.5 billion project funded by MasterCard Foundation. And with this, we were able to provide many of these countries immunization system with the vaccines they require. I supported and coordinated the provision of millions of doses of vaccines. Over 78 million doses of COVID-19 vaccines were pushed to most of these West African countries to address COVID-19 pandemic. And then later on, we used the structure to provide other vaccines like the cholera vaccines and the Mpox vaccines to be able to address other outbreaks. Later on, we also procured a number of cold chain equipment worth millions of dollars to improve the cold chain storage capacity of the vaccines. Most of our countries are poor, they are low and middle income. They require a lot of facilities to be able to store the vaccines so that they will be ready at any time these outbreaks are coming. Then they will be able to have the needed medical countermeasures, ranging from vaccines, diagnosis, and therapeutics to be able to respond to these outbreaks. So this is what I've been doing. I was also appointed the regional incident manager to coordinate outbreak responses in West Africa. So I did this for quite a number of times, and then I was able to coordinate the responses across all the pillars, apart from vaccination, which is my main focus, case management, laboratory, surveillance, infection prevention and control, and many others. So I feel I'm happy to be in the right place so that the world can know what I'm doing. Thank you so much.
Fabulous. Thank you so much. Oh, Will. And last, but certainly not least, we're going to have Judah speak. And when you are ready to show on camera and start talking, we'll be ready to listen. Judah, are you there? You've gone on mute. When you're ready to speak.
Yeah, good evening. Yeah, in the rural corridor of Tanzania, a mother walked 6 miles to a clinic only to find the antibiotic she was prescribed no longer works. She is told it is resistance, a clinical term. But for her, it is a life-altering sentence. This isn't just a clinical failure, it is a profound breakdown of justice. My name is Judah Sule Pasco, a global health society, a public health advocate, and a researcher. Above all, I'm a catalyst for the equitable Africa, a happy and healthier Africa for the future we want. I've learned that health systems are fragmented because we treat health as an isolated event. My work bridges from involving the parliamentarians to fight the global threat of antimicrobial resistance, killing a number of people in the world, but also spanning from the parliamentarian involving the policymakers to empowering the young generation, the young profession of health system in our continent and in our country. I've been working as the country coordinator for the African Public Health Network for the young profession, the public health sector across the continent. But further ado, I've been working as the program coordinator for the One Health Society, connecting the parliamentarian in the country, but working together to fight the global threat of antimicrobial resistance. Furthermore, my work have been pioneering to implement the One Health approach in our country, but also working with Africa CDC under the project Epuka Usugu Okoa Maisha, a Swahili term which means prevent resistance and save life, empowering a more than 59 communities in the country and reaching more than 20,000 people across the country. And this work have been sponsored or have been working closely with the government of Tanzania, empowering the community health workers and empowering the community to understand the clear term and solve or convert the complex term into more and well understandable Swahili language in our country. Antibiotic resistance, which is a silent pandemic, it disproportionate claim lives in our communities, specifically those without access to diagnostics. This is not just about studying the laboratory, it took to the front lines. As the project manager for the Epuka Usugu Okoa Maisha campaign, we didn't just hand out pamphlets, we facilitated dialogue, we turned abstract, terrifying threat of antimicrobial resistance into community-led action. By securing grant from South Center Framing Fund and GIZ, we pioneered this work to empower the other 59 communities across rural areas, basically in Zanzibar, where we empowered the community health workers, which was around 1,000. We empowered the young medical profession, but also we empowered the policymakers to understand clearly and basically convert the complex policies into a well understandable language to be understood by community members. But further ado, we came with a campaign which is Dr. Kiosk, where we are empowering the community members to take to diagnose their health, to check for the health status at the area stage, so that we should be able to lower the number of the people suffering from resistance. However, awareness only is the only first step, but to create the real equity, we need a scale of technology. We have been working with Africa CDC under the Network of Africa Youth in Digital Network, where we pioneer and empower different youth to understand clearly what the problem are. The Boston Congress of Public Health 40 under 40 cognition isn't just a trough for me, it is the vital fuel I need to scale this local success into coordinator standard. And I'm a digital health strategist, a oneness advocate, and a builder of a system. I'm not waiting for healthier future, I'm architecting it. One community, one policy, and one digital innovation at a time. And I'm joining you, and you should join me in making health equity the standard, not the exception. Thank you.
Thank you. Thank you. That was lovely. And just what a wonderful way to end today's sessions. I believe that everyone who is going to present has presented. I want to reiterate what Dr. Carpenter has said throughout this, that everyone just was one wonderful speech after the next. This was truly an opportunity to let folks introduce themselves to us and to others. I'm being played off. And thank you for being so game to present in such a time constraint condition. Dr. Carpenter, I'd like to hand it to you.
Yes, absolutely. So to all of you, no worries if you felt that you were cut off. The way that BCPH will be judging, will be looking at the content of your answers, not necessarily like if you feel like you didn't quite do it justice. Like I said, we will invite individuals to be able to give us, their CVs, additional information about them. So don't feel, that if you didn't say it here, that we're not going to know about it. This is one for us to be able to get to know you, right? More face to face, also to share, with the BCPH audience as well as, with the world, because, this is posted on the BCPH Studio YouTube. So have your friends and your colleagues watch that as well. We appreciate all of the hard work that you've been doing in public health, everything that you've done in terms of being able to stay here and to present. And for those of you who came on who are not under 40, do not, feel discouraged. We have a number of other events, Health Innovators, Distinguished and Outstanding Awards for that basically are age agnostic. So that can be anyone. So even people who are under 40 for those, but as well as people who are over 40. So once again, thank you so much for your wonderful contributions, within Africa, within public health as well. Appreciate you. Thank you.
Appreciate you very much. And we will be in touch. I put in the chat where you can reach out to us if you have any questions at communications@bcph.org. And we look forward to staying engaged with everyone. Yes, take care and have a wonderful day or evening, depending on where you are. Bye. Thank you.
Yes, thank all of you.